On some nights, workers at the Sunrise at East Cobb Assisted Living Facility struggled when they were trying to keep a close watch on the frail, elderly people they had in their care. Keeping the shifts staffed up could be challenging for the managers there because caregivers were leaving to take jobs at nearby medical facilities. They could get more money for working less. And that may be why the director cut a break to Landon Terrell. On the night of August 14th, 2017, Landon Terrell came to work for his overnight shift on the memory care unit. He was put in charge of Adam Bennett's care. That night ended up changing everything for Bennett and his whole family, and it would change everything for Landon Terrell too.
Do you recognize that?
Yeah.
Who is that a photo of?
It's my dad.
As the greatest generation reaches its twilight, many sons and daughters have walked the same path as Christine Hauk. She had moved her dad into what she thought was a top-of-the-line assisted living facility. The Sunrise home was only a few minutes from her house in the Cobb County suburbs. She knew she'd be able to visit there all the time. And she just wanted the absolute best for her dad. And Sunrise offered chef-prepared meals and a building designed to look like a Victorian-style mansion. But at this point, having a really caring staff to help her father around the clock with whatever he needed was what mattered the most to her. At 91, her dad, Adam Bennett, he was a World War II veteran and retired businessman, was no longer steady on his feet. This is somebody who had been an outdoorsman and he loved to go sailing, but at this point he needed help with almost every event of the day. Getting up and dressed, going for his meals, showering, getting to the bathroom.
Yes.
Okay. Can you tell the jury a little bit about the living arrangements at Sunrise where your dad was residing?
Sure. He was in the reminiscent care unit. He had some dementia. We chose Sunrise because they have a large staff-to-patient ratio. They had activities. He had a really nice room. The people seemed very attentive when we went and visited. Dad liked it, had windows and it was bright, and so he was part of these the decisions of where to stay.
With a plan that would cost about $6,800 every single month and an additional $1,250 move-in fee, Christine Hauk said Sunrise told her her father would get everything he needed. But more often than most families would imagine, these expensive private pay homes fail, not only when it comes to providing the lavish care that the homes promised. Over and over again, a significant share of these facilities fail to provide even the minimal level of care that state regulations require. When Christine Hauk moved her dad into Sunrise in June of 2017, he was sleeping a lot and he was incontinent at that point. He'd fallen a few times too, but Hauk thought it was going okay at Sunrise. She was there a lot, and when she was visiting during the day, workers would give her reports on her dad, and they popped in to take care of his needs. Georgia just requires on-the-job training and basics, things like CPR, infection control, and learning about the special needs of residents with dementia. Even then, the AJC found that facilities in Georgia do not comply with these requirements. Landon Terrell's employment record before he came to Sunrise was blemished, although even Sunrise didn't know how bad it was when it hired him. In March 2016, a home health company wrote him up for falling asleep twice on the job. He got fired from another job for sleeping at work. Another senior home got rid of Terrell after a resident's son reported that Terrell had left his dad in a soiled adult diaper for 5 hours. It's not exactly the type of caregiver Sunrise bragged about on its website. Bennett had been at the home for a month and a half when Landon Terrell arrived for his overnight shift. Hauk had visited with her dad that afternoon, and he was fine. Then, in the dark of night, Bennett made frantic phone calls to his daughter.
I'm dying, Chris. I'm dying. Need help.
Can you tell the jury what you heard your father say?
Chris said, help. I'm dying, said help.
At the hospital, doctors discovered all sorts of physical damage. Adam Bennett's face was bruised in several places. He had 4 broken ribs, a punctured lung, and a damaged kidney. He wasn't able to speak again. 3 days later, Adam Bennett was dead. Cobb's medical examiner ruled Adam Bennett's death a homicide, finding the injuries were consistent with a beating. But Adam Bennett did leave a clue about what happened to him. He pointed to injuries on his face and other parts of his body and told his mourning caregivers, "He hit me. He punched me."
When help finally arrived, he told them what happened. He said he was hit. He said he was punched. He showed them. He showed his jaw.
Landon Terrell repeatedly talked to police, giving them an elaborate story that they didn't think added up. Terrell was charged with elder abuse and elder neglect, both felonies, and murder. About a month earlier, inspectors from the Georgia Department of Community Health had visited the Sunrise facility to investigate 4 complaints. The nature of the complaints is confidential, but DCH reported back that its inspectors found nothing wrong at Sunrise. But after Adam Bennett's death, with a homicide investigation underway, DCH came back, and this time, its review found a host of serious violations.
Count 2. We, the jury, find the defendant not guilty of the offense of felony murder. Count 3.
The jury found Terrell guilty on just 1 count, felony elder neglect. One juror explained that a whole cast of characters at Sunrise, not just Terrell, seemed responsible for what happened. Terrell was sentenced to 5 years behind bars. Adam Bennett's daughter and son still struggle with their father's death. They couldn't stop thinking about how afraid he must have been and how much pain he must have endured that night. That was not how their father's long life was supposed to end.
I kind of feel like all these facilities are here just to make you feel like they're gonna help, but they're really, if you can keep your mom at home, try your best to. I wish I did.
Drawn to gleaming facilities with resort-like amenities, thousands of people have entrusted their aging spouses, parents, and grandparents to assisted living and large personal care homes that have popped up across Georgia in recent years. While the price is steep, families pay $3,000 to $8,000 a month, it's worth it for many seeking security and peace of mind. But too often, families have found an overburdened staff where loved ones were met with callousness or ineptitude while safeguards were ignored and promises broken. Many of the roughly 400 large facilities across Georgia offer quality service with dedicated caregivers, but the AJC investigation identified more than 600 allegations involving neglect and 90 of abuse by caregivers in the past 4 years. Falls are an especially pervasive and deadly risk across the system. Because many cases of serious falls go unreported to the state, no one knows the scope of the problem. The failure to report at Mountain View Personal Care Home in DeKalb carried a heavy cost for Lorna Record, a retired paralegal. When the 71-year-old arrived at the facility 3 years ago, it already had a history of not documenting harm. All told, regulators cited the home for 11 violations the year before Record arrived. Record's only daughter, Annette Coleman, knew nothing of the problems when she moved her mom to the home. Record had dementia, was blind due to cataracts, and had trouble speaking. She had a history of falls when she arrived in August 2016. 3 weeks later, Coleman grew alarmed when Record seemed to be in agony.
I went up there to find out what happened. Everyone was there, but no, I don't know, even including the person that said that she would take care of my mom. She tried to avoid me, but she chimed in every now and then. She didn't fall. I don't know what happened. Anyone that came, she's just not feeling good. Then the hospice lady, she has a urinary out of nowhere. I've never seen her before. She came over. She was like, listen, mom has a urinary tract infection. We gave her antibiotics. Please, just let it work. Finally, one of the hospice ladies said, we do x-rays. Well, why didn't you do that in the beginning? So once she got tired of me demanding, she revealed that we can get an x-ray. So then they got the x-ray and she called back and told me, your mom has a broken hip. And then everyone started ratting everyone out.
They let her sit with a fractured hip for 9 days.
Record was taken to DeKalb Medical Center and a few days later had surgery. She died 3 months after the fall.
There was an autopsy that was performed because she passed it outside of the facility in someone's home. And the autopsy report shows that a significant contributing factor to her death was the fractured hip.
State records indicate Mountain View was less than forthright with Coleman.
They still deny today that she had a fall.
The state cited the facility for failing to give proper care and failing to take appropriate action when Record's condition changed. Coleman is still anguished at the thought of her mother's suffering.
And again, that was the only choice, is to get help. Anything to ease your mind, I guess. I tried, it don't matter. I kind of feel like all these facilities are here just to make you feel like they're gonna help, but they're really, if you can keep your mom at home, try your best to. I wish I did.
While abuse is less common than neglect, the cases demonstrate disturbing breakdowns with caregivers robbing vulnerable residents of their dignity and subjecting them to physical pain. More than 100 residents were reportedly abused by workers of assisted living and large personal care homes over the past 4 years, the AJC found in examining police and DCH reports. Arbor Terrace in Decatur received a state citation in March 2018 after an aide was accused of abusing a resident late at night. 9 months earlier, a separate allegation of abuse involving 2 other employees surfaced on the night shift. Police were called to the memory care unit after an 82-year-old resident with dementia said an employee on the night shift broke her arm. Resident Patricia Reed, a retired Agnes Scott English professor, told police after she confronted the woman about making too much noise late at night, the woman twisted her arm and she fell to the floor. Police arrested medical technician Natasha Lewis and charged her with neglect and abuse. They also arrested another employee, Mary Harvey, who police say witnessed the abuse and failed to report it. Both women denied harming Reed, but they said they entered plea deals last year to avoid the possibility of time in prison. Harvey told the AJC that Arbor Terrace was in turmoil at the time of the alleged incident, and she felt railroaded by its management.
I get a call from Fatima. She tells me, Mary, you've been suspended. I'm like, for what? She said, for an allegation you, Tasha, drug Miss Reed down the hallway and broke her arm. I said, that never happened. I was so upset. I'm like, how did you guys get that? I don't know where they got that at. How did it get here? I was so upset. I was so upset. I'm like, dang, they're gonna say that we did something to this little lady.
She said she still regrets pleading to a misdemeanor and not fighting the charges in court. In response to questions by the AJC, including how the company hired Lewis even though she had been convicted of robbery with a firearm in Florida in 2000, a company spokeswoman said employee background checks and employment guidelines meet and exceed the standards set by state law. The facility said, quote, "We're proud that we are able to offer our residents improved quality of life."
Good evening and welcome. I'm Bill Nigut. Tonight, Georgia Public Broadcasting and the Atlanta Journal-Constitution present Unprotected, Georgia's broken senior care industry. It's an important community conversation about a difficult decision that most, if not all, families eventually face. Who will take care of our aging loved ones? The senior living industry is booming in Georgia, with more than 400 assisted living and large personal care homes in operation across the state. But do families really know what's going on there? The Atlanta Journal-Constitution spent more than a year looking at this topic. What they found in their investigation was shocking. Joining me is the editor of the Atlanta Journal-Constitution, Kevin Riley.
That's right, Bill, and thank you for the opportunity to help shine a light on this critical issue for your viewers. The AJC's reporters reviewed thousands of violations and found cases of neglect, abuses, and indignities that our senior citizens have experienced at even some of the most expensive facilities that promise attentive and quality care. Since publishing our first story in this series, we've heard from so many people wrestling with this issue. We've heard from families, advocates, and lawmakers who all recognize this as one of the most important issues in our state. We hope public forums like this one will inform and empower citizens, and that our investigation will lead to changes that better protect Georgia's seniors.
Thank you, Kevin, and congratulations on this series. Thank you. In a moment, we're going to begin our conversation with the reporters, along with a panel of experts and our studio audience. But first, let's go behind the scenes of senior care with the AJC reporters to see how they uncovered this unsettling story.
You start with one question, it leads to two or three others, and before you know it, you are involved in an investigation.
In our groundbreaking report, the Atlanta Journal-Constitution exposes how Georgia fails to protect senior citizens and how their families had no way of knowing what's really going on.
What is going on here? They really talk a great game, and we wondered, is that true?
When I tell people about the project that I'm working on, almost every one of those people has the story they want to share with me. Their own personal story. How do we take care of mom, grandma, my husband?
When we're at our best, we are doing a story like this that touches everybody. One of the most important things we do for our community is connect the dots.
Some of these places charge up to $10,000 a month.
Sons and daughters and grandchildren are all contributing money to put their relatives in a place they think will be safe.
They're beautiful. They have chef-driven menus. It all sounds so wonderful.
If you try to get information on these homes by Googling them, what you're going to get is their marketing websites.
There are things that we wanted to know that even some of our officials would not answer.
There were so many things that stunned us.
Yeah, no government official or anybody really wants an investigative reporter to show up at their doorstep.
This is Carrie Teegardin with the Atlanta Journal-Constitution.
We're taking a look at the assisted living and personal care home industry, which has been booming in Georgia.
It's one of the most ambitious projects that we've undertaken here at the AJC. Part of what we're doing is taking a very close look at every facility in Georgia.
We started filing open records requests, and I went methodically through the website, reading the inspection reports that were there and building a database.
We've looked at more than 3,000 inspection reports. We've looked at hundreds of police reports, scores of lawsuits.
Our experienced journalists asked the tough questions, uncovered the real facts, and revealed the truth.
5 days after being discharged, the resident was found not breathing and was rushed back to the hospital and found to have severe sepsis. 4 days later, the resident died. So that's the information from the DCH report.
In this stack right here, I have everything from arrest reports to regulatory reports to notes on facilities.
One of the things all good journalism does is empower citizens to demand accountability of their government, of organizations, of these regulatory groups. Only the AJC can do this essential work for our community.
The federal government has no role in the oversight of personal care homes and assisted living facilities. It's up to the state.
The large and small indignities that people are suffering in some of these places, it's shocking cases of neglect.
People actually being physically assaulted. Thefts are just so common.
A home is obligated to take certain measures to safeguard them, to prevent them from falling. That was not taking place. Residents had gone missing, medication errors. Too many homes did not do criminal background checks on employees. A woman repeatedly pushed her emergency call pendant. No one came.
Families had no way of knowing what's really going on.
The most important thing is to have information, be informed.
One of the unique features of this investigation is the database that the reporters have put together.
When you work on a project like this, certain days are kind of tough.
When I'm late getting home and rushing to a carpool and trying to cook dinner and trying to get the dog walked, I share with my kids the stories that I'm working on, and they know about it.
And they know that these things are important. Certain stories really stop you.
We feel responsible to Atlanta and Georgia because we know no one else can do a story like this. No one else can do a story like this. And what that means is we do it or it never gets told.
The stories that the AJC tells are in many ways are tragic, they're frightening, and we're going to delve into them in much more depth tonight. Here to help us understand the nature of the pattern they discovered and how to combat it are the reporters who led the AJC's statewide investigation, as well as other key individuals who are monitoring Georgia's senior care industry. So I want to start by introducing Carrie Teegardin, who was a huge part of this, along with Brad Schrade. Before I introduce the other, I just want to say very quickly, at a time when news organizations are not able or don't feel the need to invest in long-term investigations, the fact that you two led this effort is very powerful, and I congratulate you on the work that you did. I look forward to talking with you about that. Also with us tonight, State Representative Sharon Cooper from Marietta, Jason Marbut, he's Cobb County Senior Assistant District Attorney, Melanie McNeil, Georgia Long-Term Care Ombudsman, and Ginny Helms, who is the President and CEO of Leading Age Georgia. Thank you all so much for being with us. So let's start. Carrie, you know, what's powerful about the work that you and Brad did is that you not only compiled an enormous amount of data, but you told really, really powerful human stories. Yeah. And you started the series with a terrible tragedy. Yeah. Adam Bennett, 91 years old. Sunrise is the facility he was in East Cobb. What happened to Adam?
His family had gone to great lengths to pick out what they thought was a great facility. It was quite expensive, over $6,000 a month. You know, Sunrise is a big chain, and they'd been told they could take care of his needs when he was getting really frail. And then one night, a really terrible tragedy basically played out, where he woke up that morning. He told his caregiver, he hit me, and showed on his body, told another caregiver, he punched me. He had bruises on his face. He had broken ribs. He had internal injuries, it turned out later. And And the caregiver in charge that night was eventually charged with murder.
And this was happening on the overnight shift.
Yes. And so this was, again, a place that his family was very involved with. Yeah. They were visiting him all the time. It was, you know, a building that looked like a Victorian mansion. It certainly was, there was really, the family had kind of done their part. Were very involved and felt like they were paying for the highest level of care.
But, you know, so this is a terrible story about abuse. But if it was one incident, you'd say it happens. It would still be news. Yes. It would still matter. But that's not what you learned. I mean, you and Brad learned over a period of time that a lot of these facilities that you looked at were understaffed. The staff was poorly trained. There was a lot of turnover. And they were paid very little money in many cases, the people who were there. So, I mean, this was a pattern.
I think what's really shocking about the death of Adam Bennett is that it's probably pretty routine. It's just that it happened in a place where the family thought to call the police, and the district attorney's office took the case seriously and actually prosecuted it. This facility, the things that were happening there, the lack of training, the lack of staffing, the constant turnover, the failure of the management of this giant national company to address issues is commonplace. This is not an outlier. This is what is playing out every day in these facilities, and that is what our story is about.
Jason, you prosecuted this case. Yes, the defendant, the caregiver, Landon Terrell, or Terrell?
Terrell, yes, sir.
Mm-hmm. When this case came to your office, tell me how you received it, how you reacted to it, what it felt like to you.
You know, we get cases like this. As part of my job is to review cases when law enforcement brings them. And this was a case where I was at least aware of it during the initial week or two as law enforcement was out doing an investigation. But then we let law enforcement do their thing from the DA's office. And so we waited until their investigation was over and it came to us. That is something that we've built, or a model that we've built for our county, is that when these sorts of cases arise, I try and be a resource. They have my phone 24/7. They can call me. We can talk about what's going on as they're the boots on the ground doing the investigation. And that's what we did in this case. It was one of those cases where it was the tale of, I guess, two different versions of what could have occurred. One was that he was assaulted. And that certainly was what the victim told people in the morning. That's the voicemail, that horrible voicemail that, he left where he said he's dying. Or the version of events given by the defendant as he gave to law enforcement later in the day as they began to investigate, which was that this was an accident.
But when you looked at his record, this was not a guy who had a pure past, as I recall, from the series. Am I right about that?
I think it's, I'm not sure that I would use the word a pure past. I'm not sure that I would overplay it either and say that he had a criminal history. I don't think that's appropriate to label him that way. I think what came out at the trial was that he wasn't the greatest worker, that he slept on the job, that he was not someone who necessarily should be counted on to be the only person who watches a large group of people who have the sorts of issues at a reminiscence or memory care unit.
Okay, so, by the way, what was the outcome of the trial?
There was an acquittal for the murder charge, and there was a conviction for elder neglect.
Yeah. Jason makes an interesting point, Brad. It's somebody like the defendant in this case probably shouldn't have been in a position to oversee so many people in the facility overnight. And that's one of the real problems that you uncovered in terms of understaffing. And even state requirements seem to play into that understaffing problem. What is it? One staff for 15 residents during the day, one for 25 at night, right?
Yeah, we found 20 deaths across the system that were related to problems with care that the state cited. So, and in a lot of these cases, they were residents fell. There was they were injured. One woman fell and was left for 12 days before getting treatment. These facilities, in many cases, we found were understaffed, and they're paying employees $10, $12 an hour. And in many cases, these employees are left in impossible situations, in some cases, to care for people that have higher needs than maybe assisted living was intended for originally. They're supposed to do ongoing assessments to make sure that the facility is supposed to do an ongoing assessment to make sure that they can care for the resident. And in many cases where things went wrong, we found that those kinds of things were not happening in the way they should have.
I don't want to get completely away from this case yet. Jason, so he was acquitted. What were the circumstances that led the jury to an acquittal? They believed the story that Landon Terrell told about what really happened?
Bill, all I could do is speculate. And,
sure.
And certainly we talked with, at least one juror stayed afterwards. I think that this was a case where they deliberated for several days.
Yeah.
Really did. My best sense of it is that they couldn't wrap their brain around the concept. Once they decided that it wasn't an assault, or at least that there was reasonable doubt for an assault, I think they then moved towards what else. I think he was convicted of neglect because he admitted that Mr. Bennett told him he was in pain and was suffering and that he did nothing. So I think that was absolutely where they were going to fall on that verdict. Everything else was where we could go beyond.
Carrie, in some ways, that's a really crucial piece of this story, as I recall having read it when it appeared that first Sunday. It was as much about how long he went without assistance, right?
And just all these things that played out overnight.
That's my point,
I think the jury felt like, oh, we wanted a video to see what actually happened. Oh, this is an old man who's 91. Can we really believe him? And I think that's something we're trying to really make people think about.
But he was in pain. He tried to get help, right? And it didn't come until the next. There
were a few other people in the facility, but no one else was called. I mean, this is a facility where one night one of the employees called a manager to say, "Look, the staff. It's Friday night. They've stepped out again." Apparently for clubbing or whatever they were doing.
Yeah,
I mean, it's a facility where there were all sorts of things going on that weren't addressed. And so if you think about it, I think what Jason really showed us in this trial was that you're in the middle of the night, you're a very, very vulnerable elderly person who needs help with almost everything, and you're relying on this one staff member. And there's just not a lot of space there.
Jason?
I think that's absolutely right. And I think that something else that you touched on, Carrie, is we don't listen to folks who are in those positions.
Yeah.
We discount what they say, and it's this double standard. On the one hand, we put them, or he has to go in a facility, the victim here, in a memory care unit so that he can have extra assistance. And then when it's not provided, you don't listen to them when they start telling you that there are problems, because there's somebody who you can't pay attention and listen to.
Sharon Cooper, Representative Cooper, you've been a champion for a very long time on issues around health care, around providing something for the needy to get the kind of appropriate care they need. I know you've been very concerned as you've seen this story. So let me start with a basic question. Georgia requires one staff for 15 residents during the day, one for 25 at night. Is that something that's got to be looked at right away?
You asked me earlier if I had a list of things that needed to be changed, and that's pretty much at the top.
Yeah.
That is not enough. And one of the problems, it was like you said, is that the facilities, and part of it I think is competition, and they've had so many open up and they want to keep their beds full, they are taking people that should not be in an assisted living facility. And they're sicker or have more intensive care. I'm a registered nurse. They need more skilled nursing care and shouldn't be there. Or some facilities will let someone stay if the family then hires a caregiver to help with the care that they need that's in excess of what the facility, you know, is supposed to give.
So I realize the session is still several months away, and you're still absorbing a lot of what you've learned through the AJC's reporting. But when you think about that ratio of caregiver to patient, how are you viewing that at this point in terms of the changes that need to be made? By the way, is that statutory, or is that a regulation established by the Department of Community Health? Where does that live, that particular requirement?
It would probably in regulation,
Okay.
but not exactly. I don't remember that being in the actual bill. It's by regulatory, I think.
Okay. Do you know down there?
I was leaning over. I figured Melanie would know.
Melanie?
Right. So yes, it's in regulation.
Okay. But so how do we, what you say that's like at the top of your list right now.
Right.
What do you do about it?
Well, it's so abused, I think that maybe it does need to be in statute.
Yeah.
But, you know, maybe a small given range. I mean, one of the things that I've said to the people who run mainly nursing homes until this story broke, the most complaints were about nursing homes. And I would say, we're having terrible reports on care, and they would say, we need more money, we can't find staff. And I would say, well, if you can't find staff, then you need to drop your census and only take care of the number of people that you have the staff to adequately care for.
Yeah.
And then I would hear, we need more money.
You know, we'll come back to that, I think. You know, Melanie, it's interesting. One of the things that surprised me a lot when I read this series was, you know, of course, like everybody in this audience, and whether they're here with us or watching right now, is we've seen this explosion of these assisted living facilities in every neighborhood as we drive across metro Atlanta. And what surprised me was I didn't realize that it wasn't until 2011 that the state put into established regulations that allowed for this kind of new category of caregiving, right?
Actually, it was a statute, and it took us 16 years to get it through the General Assembly to create this additional level of care.
Tell me, because it really plays into a lot of this reporting, what is it about? What's special about an assisted living facility as opposed to say, a nursing home?
Well, as advocates, what we were thinking about at the time was skilled nursing is 24-hour medical care, essentially. I mean, it's available. Personal care homes, absolutely none.
Right.
They're not allowed to do that. So what we were trying to do was get something a little bit in the middle. So you could get some care, but it wasn't quite at the level of skilled nursing.
It makes sense, right? I just want to make sure that our audience understands that this is a new niche, basically.
Well,
you know,
can I say,
Sharon?
Well, and like Melanie said, it took us 16 years. I wasn't there for the whole 16 years, but it was a knockdown, drag out, because the nursing homes like to take care of patients that needed very little care, that were still very with us and, had not lost any of their mental faculties, but maybe needed a little help getting around. And they fought the assisted living tooth and nail because they wanted to keep that kind of patient because they were easier to care for than people who needed a lot of skilled nursing care or bedridden.
So we start in 2011, this whole new category, and what we're learning, thank goodness, because of the AJC's reporting, is that this still needs a lot of work.
Yes.
And you're intending, and as we go through the show, we'll talk about more of what you want to do. Ginny, let me bring you in, if I may. First, could you establish for everybody, as president and CEO of Leading Age Georgia, I'll bet there are a lot of people who aren't quite sure what Leading Age Georgia is. So first, tell us what your organization does.
We're the association for the not-for-profits and mission-driven organizations that serve older adults through housing or other services.
Okay, so and that includes working with the assisted living facility. All right, so before we get back to some more of the reporting that's important, as you looked at this series, as you watched it unfold, you're a lobbyist, which is fine. So you have you're a nonprofit lobbyist. We need to make sure that people understand that. But you do have something you got some skin in the game here.
Right.
Just in general, as you read Brad and Carrie's series, give us your general reaction.
Well, first off, I found it very interesting, and I've been thinking about it a lot and just reading it, rereading it, and thinking about where do we need improvements. And I did look up all of our members, and I thought that they had some great surveys, and so that felt good to me, obviously.
Your people did not fall into many of the, you didn't see the problems that they found in so many facilities.
Not so much.
Okay.
But with that said, I do think that there are a lot of great for-profit providers out there as well. But in looking at it, I kind of thought of it from two ways, one of which was how are we going to improve what's going on across the state? And that's really what I focused on. And I will say that in Georgia, we at once had one of the highest rates in nursing homes for antipsychotics in the country. And the way we dealt with that was we have one of the best quality improvement organizations in the country with Alliant Health Solutions, and they brought us all together and said, let's talk about how we're going to improve this. And that's what I kind of think we need to be doing on this. And with every different story, I thought about, well, how do we address this particular issue?
Yeah. Brad, let me come back to you, because after that powerful first story, you were the second story in the series, and you really laid out the landscape for us in that. If you don't mind my reading some of your findings and then ask you to comment on them. Your story summarized 600 cases of neglect. This was all research that you all did as a team and put this data together, right?
Yes.
Okay. 600 cases of neglect, 90 cases of abuse. You found assaults, thefts, residents left injured on the floor, people in bed soaked in urine, sort of in the Adam Bennett case, people lying in bed needing help for hours at a time, 20 deaths that were related to poor care. And then maybe the most shocking thing of all is that violations that are discovered that don't rise to the level of a prosecution, what's the penalty under state law? What's the most?
We found cases where people died, and the state fine was $601, and that was surprising to us when we first discovered it. But that's what the law and the regulations say and how it's enforced. And so I think there's we heard from a lot of people that said that's something needs to be done. That doesn't seem right. And so, you know, that's the regulatory system. There's not a real high penalty for a lot of these kinds of violations. It's just not. That's just not part of, you know. I mean, when you're paying $8,000 a month. You know, and then you die as a result of some kind of neglect or problem, and the facility gets paid gets charged $601 in a fine. Those numbers are pretty striking.
So we watched video with you and Carrie on your telephone, looking for information. So when you would call a home, either of you or both of you, really, and start with you, Brad. When you'd call a home and say, we just discovered that you had a patient in your facility who fell down, was lying on the floor. Presumably we've seen a story about how he's lying on the floor for hours, nobody helped. In general, how did these facilities respond to you?
One of the things that was really interesting about this, because of the nature of this industry, a lot of times when we would call a facility to sort of say, hey, this person died, the state cited you, you know, what can you tell us about this? Or we want to get your side of the story. We would hear from the facility, well, that was the owner before us, that we don't know anything about that. Or
would that be true in case?
Yes,
okay,
and because part of what we've learned in reporting on this, and again, one thing that needs to be clear is there are a lot of very good facilities that provide good care. So, I mean, that's a sort of starting point, but this is an industry that's, you know, oftentimes is a real estate investment, or You know, there's millions of dollars at stake in these properties. Many of them are shiny and new, but they do change hands and they do change names. And so we would hear, hey, that was the last owner. We just bought it in August and we don't know anything about this.
Representative Cooper, that to me would be something that you've got to explore in some. I mean, I don't know what you do to legislate against people turning over a business, but it's troubling.
Well, that would be pretty hard to do.
Well, I understand that.
People are able to invest in them, and I think that's one of the problems that we have. People are more after the profit motive instead of the care motive in these homes. But the one thing that we can do, I think, is the state can be stricter on their inspections. We need a great number of more inspectors to go out.
All right, I got to interrupt you. They're going to change out your microphone because they say apparently the battery's running out. We don't want that, Sharon. You're an important part of this conversation. You know, let me go back to what I just said. So, okay, I get it. We're going to support free enterprise on this program. People can turn over their businesses. But it also sounds like what Brad is saying, Carrie, is that somebody who sells their business, who's had some of these terrible incidents, there's no way to, the state isn't going after them, regulators aren't going after them. Am I wrong about that?
I would say a really revealing part of working on this series was the lack of cooperation we got from the state of Georgia. The state of Georgia would never do an interview with us. They would only answer questions in writing. As we started to peel back the layers in their own records, trying to get information about, were they tracking who the different owners were? Were they getting information about these places? Were they inspecting? I would say the state oversight is very lacking.
Okay,
so,
I want to drill down on that just a bit. What do you mean the state of Georgia wouldn't? Who wouldn't talk to you? What agencies wouldn't respond to your request?
Yeah, the Georgia Department of Community Health, that's Frank Berry, is the name of their commissioner. It's under their umbrella of healthcare facility regulation. The head of that department is a person named Melanie Simon. They would not meet with us. We tried to go to meetings just so we'd have a chance to encounter them and try to express to them that we want to talk to you about how you do this. We want to talk to you about your data. It was very frustrating. I've been a reporter at the Atlanta Journal-Constitution for 30 years. And the inability of a state agency that is supposed to be working on our behalf, the public's behalf, and their unwillingness to talk to us about their process and even share their public information was deeply disturbing to me, to be quite honest. And did that stop us? No. We found a way to get every single inspection report that they'd ever done. And we found a way to convert that to a database. And at a certain point, just last week, they finally admitted that our reporting was important, and they acknowledged it for the first time.
That's wonderful, and that's, that's important. And Melanie, I was going to ask you as an ombudsman about your experiences in working with the state. I mean, I get it. State agencies are scared to death sometimes of journalists. I understand that. It's unfortunate because they should have had a chance to tell their story back. But what's your experience as an ombudsman of working with the state on when you have issues that you need to deal with? Are they responsive when they're not being pestered by these journalists?
Well, the way we work with healthcare facility regulation, so just for the audience, with ombudsman, we go and get complaints. We visit facilities and we get complaints from residents, and we try to resolve them first. And for us, we're going to pay attention to what the resident says, whether they're in a dementia unit or not, because for us, it's all about the resident. If we can't resolve the issue, and a lot of times we can't, we refer it to healthcare facility regulation.
Oh, okay.
Because they're the regulators. We don't have the ability to fine a facility or to take other action.
No, of course you don't.
Right. But when we report to healthcare facility regulation, we run into the same thing.
That's my
They don't really respond back to us and say, this is what happened. Now, they might call our ombudsman representative to get a little bit more information about what we uncovered. But we don't get a report back from HFR that said, oh, we got your complaint, and here are all the details.
Brad, you want to jump in?
Yeah, one of the sort of critical findings, I think, of our series and our reporting is that this is one of the problems for the public. There's so many gaps in the system. There's the regulators that go out and investigate. There's the police that go out and investigate. There's prosecutors that need to review cases. And we found that time and again, these different entities are often not sharing information. One of the most striking things, we shared some serious cases of neglect and, problems in DeKalb County with Gene Canavan, who's the elder abuse prosecutor there. We had, I think, around 17, 18 cases, including 3 deaths that were questionable. She had seen one of the cases, and it was not one that the state regulators had ever investigated. She was really troubled by the fact that all of this had been going on in DeKalb County. She's the elder abuse prosecutor, and she had never seen these cases, many of them that the state had cited a facility.
All right, let me round out this portion of the conversation by going back to you for a moment, Jason. You prosecuted the death. Do you believe that if that case had not, so it came to your attention, you took it seriously, you understood there were 2 sides. You understood some people saying this is an old man, who knows what really happened. I would imagine there are many prosecutors' offices who would be very unwilling to prosecute in a situation like that. And so I wonder how you see that problem developing out there.
I think you're absolutely right. In fact, the defense expert for the defense was a contract medical examiner for another county who came in and said, this is more consistent with a fall than an assault. Of course, he was paid a lot of money to say that. And worked on the side to say that, right? We have worked in my jurisdiction over the past few years to try and tackle this problem. We still have a long way to go. These are the cases that keep me up at night. And this case is one that I lived with and will always live with, of sort of, did we do enough? Yeah. Did we communicate the story enough? You can only prosecute what you know about. You can only present to the jury what you know. And I absolutely agree that there are other jurisdictions who don't have as many resources as we even have in my county, and my county doesn't have enough.
Okay. Look, this is great. We've got, though, a big audience here in the studio. We've got people watching online who really want to jump into this. So I want to turn to our audience and tell you that we would love to hear some of your questions. If you have one, raise your hand. When the microphone comes to you, if you'll stand up and give us your name. We've also got people online who may write in a question. But let's start. You also got questions, your AJC team, from subscribers who sent questions in advance. And I'm going to start, as we get ready for the audience, for one of these. And Sharon Cooper, this one's made for you. It's a very simple question. How do we hold the homes accountable?
Well, one way was making the fines substantially more. And one of the problems we have is that they have to be self-reporting. I mean, the state could not hire enough investigators to uncover every problem. And the homes are supposed to be self-reporting when there's problems, and they don't do it. They don't report abuse to the police, and they often don't report it to the state. And we have a state law on mandatory reporters. And if you don't do that, and it gets reported to the state because it becomes a police report, I think that those people should be prosecuted.
Yeah, okay.
All right, and that would be one thing, is to, prosecute people because they don't, and that own these, because they don't report, they're mandatory reporters, and to increase the fines. And also, we have a lot of work to do with our state agency and what they do once they get those reports.
Ginny Helms, what role can Leading Age play in all of this?
I think that the main role that we can play is helping get the education that's needed out there. We've been a big partner in the culture change movement, where we help bring in training that helps the staff really see the person as an individual. I know in one case, this whole team went to the Eden training thinking they were going to learn how to deal with this difficult resident. What they found was it shifted them, and they learn to see that person as an individual and could provide the care. So we really need more training, and we'll be promoting more and more of it.
We got a question in the audience. Hi, if you could just tell us your name and ask your question.
Rosalie Parkey.
I'm sorry, say it again.
Rosalie Parkey.
Thank you.
I was wondering why, well, first of all, I agree the fines that facilities receive are not inducive to them correcting things. They're too easy to pay off. Why couldn't you increase these fines, but also tie that to the transfer of operations of a facility or the real estate, much like we have mechanics liens? You can't transfer real property without clearing up a mechanics lien, even if it's several $100s. Why can you not tie these regulations and citations to the facilities so that they cannot transfer ownership?
Thank you. It's an interesting thought, and it is one. It is one. You know, it is one way to deal with the issue you were talking about, Brett. Oh, I'm sorry, that was the owner before me. Right?
We only have one lawyer.
Yeah.
I'm a nurse. I don't know that, but.
And she leaned over, and I get this a lot from Jason.
You're a lawyer too.
I'm not sure. I mean, I think the question was, why can't we? And I don't know of a reason why we couldn't.
So here's an interesting, okay, here's what I think is really interesting about that. Later on, we're going to talk about what are the next steps.
Yeah.
And I would suggest that the people in this audience, watching, wherever you are, you know, you have as much potential to offer suggestions for the kind of legislation that you think, and Sharon Cooper is nodding vigorously. You can offer ideas, and maybe something like that is one that legislators would look at very seriously. We got another question over here.
Hi. I wanted to ask about MAP to Care. As a past ombudsman, HFR, Health Facility Regulation, used to have to keep up MAP to Care, which had the results of recent visits by HFR to facilities.
What's HFR for our audience?
Health Facility Regulation.
Thank you.
And they're the ones that have investigators that go out, and people could go on if they were looking at assisted livings to see what their most recent.
Okay, so do you have a question about that then?
Why don't they make sure that that gets funded?
Did you all deal with HFR and you talk about it a little? Or go ahead.
We spent a lot of time trying to use MAP to Care.
What is MAP to Care?
And MAP to Care is the state website where you're supposed to be able to go out and get inspection reports. The problem is, imagine if you were, we've all seen the restaurant inspection reports and the scores. Imagine if they waited 6, 9 months, a year before they actually posted that the place had failed. That's essentially...
Oh my God, what would the metro section of the AJC be without a daily inspection failure?
Exactly. But I think that's kind of the situation we're in. Sometimes the reports aren't even there. When they are, they show up months afterwards. It would be impossible for most consumers to even find this website, right? Well, that's the problem. Yeah.
Okay. We don't have a microphone with you. I'm sorry.
What I'll say is that's why the Atlanta Journal-Constitution actually created a website that people could use to actually find this information. That's how bad it was. We had to step in.
Let me take a question from somebody who's watching online. And that person asked, what's your opinion on the authorized electronic monitoring of resident rooms to prevent abuse and neglect? Well, I want to go to the lobbyist first on that, because, boy, does that raise some interesting privacy issues.
Right. And that's my concern. You know, I spent 21 years with the Alzheimer's Association, and I love them, and I love the work that they do. And, you know, I think about the person who has dementia that doesn't have the voice to say, I'd rather not be filmed in this condition. So, you know, I think that needs a whole lot of thought if that ever moves forward.
Well, what's interesting about that is that's not a new idea to you. You obviously have been thinking about, people have been bringing that to your attention. And Carrie, you're nodding about it too, yeah?
I think it's a dignity issue.
Okay, all right. We have another question in the audience.
Yeah, my question's related to the AJC database that you created. The strength of your story I thought was really the research that you've now put in a usable format. And my question is this: what's the intent of using that going forward, or has there been any talk about how that could be expanded and be online? Because I think the transparency of that data. If I was going to take my parents somewhere, I would walk in and any facility would probably look fine, even though they might have problems in the past.
It is phenomenal that you, and we can get to it. We're going to mention a website, the URL later, I think.
Well, first off, thank you. And we're planning to continue to update it as reports come in. You know, for the foreseeable future, we hope to be able to update it so this will move forward and people will be able to use this. And so stay tuned. We're going to continue to kind of put reports as we get them.
I want to do one quick thing here because I think it's an important part of the conversation. Ross Perlow is in the audience. I happen to know Ross. We've been friends for many years. I knew about his mother, Betty, from just personal experience, but you wrote about his mother.
Yes.
What happened to Betty Perlow?
Betty Perlow was living in a very fancy, very expensive community called Summerby, and which the family felt they really went to great lengths to find a beautiful place. And Mrs. Perlow was basically attacked by ants that the facility failed to address. And this went over a couple of days. She was not in good health at that time. And that incident clearly hastened her death, and I think led to something I've seen in a number of these cases, when a family member's final days don't play out like they should. Everyone wants to say that their family member died peacefully with family, and it kind of happened like it should have when somebody's in their 90s.
So here's why I wanted to call attention to it. Roz, if you wouldn't mind standing up, and I appreciate your being here tonight. Look, you and your wife, Michelle, are smart, well-educated, aware people. You would never go into a facility without being completely, scrupulous and look at it with great integrity, and yet it even happened to you.
It did. You know, the sad part is that we were one of the families that hired a private aide in a memory unit. And our private aide had reported a problem. And a week later, she came back to work and asked if the situation got taken care of, and it hadn't. And the next day, things turned south. So it was sad. And we are in the industry.
Yeah.
I market long-term care insurance all across the country. And that wasn't the issue. We looked for the best place. We talked to everybody. I was probably there on average of 2 or 3 times a day. And it just, what do you do?
Well, thank you.
So I appreciate the fact that you're bringing it up, because we're not the only people that it happened to.
And thank you, Ross, for being willing to tell your story first to the paper and then here tonight. Judith Kaufman is with us. Tell us about Judith Kaufman before we introduce her. Where are you, Judith?
She's right next to you.
Yeah, Judith, her mom, Sally, had a stroke and was in a wheelchair and she needed to find a place for her. So she found a place in Dunwoody, and her mom loved going to the weekly church outing at a nearby church. And on one Sunday afternoon, there was one staff member that drove a van with several of the people from the assisted living facility that attended church. And a volunteer didn't put the brakes on the wheelchair, and it rolled across a church parking lot, hit a curb, and her mom spilled onto the ground and broke her leg. It was a severe fracture. And one thing that Judith told me as she was telling this story was, you put your trust in these places. They tell you they're going to be there. They tell you they're going to take care of your loved one. And when that's the ultimate contract, that family members depend on that and expect it.
Judith, I think one of our cameras, I can't see you, but I'm hoping that Okay, you can see her in the audience. Judith, what Brad just said is exactly what I was thinking. And Ross is the same story. This must feel like one of the greatest betrayals that you could possibly experience in your life. To not have a parent, a loved one, taken care of in a place that you've turned for help.
Like this gentleman before me, I was over there all the time. I didn't live but 2 miles away, and I...
Hold the mic just a little closer.
Okay, I became a first-name basis with just about everybody that worked there. I felt like, you know, they knew I was going to be there, so they would treat her like she should be treated. The problem that existed on that trip, and she'd been on that trip more than once, was the caregiver didn't have the second person to help her to load the people on, and their device that put people on the bus was broken.
Ugh.
And so she didn't have any place to go, and the gentleman who did this, as far as not putting the brakes on, said he put the brakes on. But obviously he didn't, because if he'd put one brake on, it would have done 180. It wouldn't have gone down.
Yeah.
Right. And,
Well-
and so he's
Well-
a volunteer. He was a reluctant volunteer, actually.
Well, thank you again. These are such heartbreaking stories, but thank you for being willing to share with us. Sharon Cooper, there are going to be incidents, some of them awful, but that can't be resolved by regulation.
Right.
And yet, you hear a story like that, and your heart goes, you as a nurse especially, your heart goes out to Ross, to Judith, to everybody.
It does. And, you know, my own mother was taken for money before, you know, I got guardianship over her. And luckily for her, I could replace the money, and it wasn't going to mean that she would go without food or medicine. So I've experienced part of what's happening to the elderly. And one of the problems that we're having, the state is trying to catch up. It's just like we can't catch up fast enough. It's like child abuse was 40 years ago when nobody knew what child abuse was. Jason and I worked together with the Northeast Georgia Elder Abuse Task Force, and that group of volunteers is going all over teaching police what elder abuse is about and how to identify elder abuse when they're called to facilities. Many of them don't even know how to identify it or what it really is. The Prosecuting Attorneys Council has hired one lawyer just to deal with these cases, to go to all the circuits across the state
Right.
to try to educate the prosecutors and all about prosecuting elder abuse. And our prosecutions are up. People are being charged.
A very quick question from online, and then we have a question we'll get to in the audience. And real quick, one of our viewers online says, did you see examples of food preparations that were not done, were not healthy, where there were problems with the food, where, you know?
No. Yes, we did.
Okay.
I mean, there's food that's prepared that's not safely chopped up, or, you know, the doctor will order a certain diet so that the resident doesn't choke.
Are there inspections of the kitchens that are done routinely by the state, by regulators?
There are food inspections, but they are very difficult to. If you're a resident, I mean, if you're a prospective family member going out and looking for these, you wouldn't necessarily be able to find them.
Okay.
We posted some.
Of course.
We looked at all of that for every facility, and we found some that failed, like their restaurant inspection.
Yeah.
And then also when community health comes in, found issues with the failure to have adequate food. Some didn't have snacks, didn't prepare, again, the medically required diet.
Right.
That's very dangerous, and that can kill people.
Let me go to a question in the audience.
Hi, so I remember in high school being paid $15 to $20 an hour to babysit.
Yeah.
And it doesn't take much skill to heat up bagel bites and play goldfish. So my question is, where's the money going to come from to get adequate staff? Not that the low wages would ever justify abuse or neglect, But where's the money going to come from to get the level of care these people need?
You know, one of the reasons that's a particularly interesting question, of course, is how do you did you look at the business models? I mean, that wasn't really the focus of what your series was, but I would think examining the business models of these companies would really be revealing in many ways.
Yeah, it's important to say our reporting is ongoing, so we're looking at some of those. I spent all day with documents today. I would say, you know, you talk to anyone in the industry, their big concern is hiring staff and hiring qualified staff. They all have anybody will tell you that's their big concern. And whether you go to some facilities that don't have constant turnover, that do keep people, and so it's not impossible. You know, talk to some people in the industry, they make it sound like, oh, we can't get people. Well, there are some that do, and I mean, Ginny may be able to speak to that.
Yeah, I was going to ask you, Ginny.
I think the workforce issue is pretty complicated. We have to really work to fortify them. We have folks that are taking care of people that have higher acuity than in the past, so they really need to have the training for it. They need the support, and they need managers who can work with them and really have a team so that when they come into work, they can stand around and talk about the changes in different residents, know them, and really talk about how they're going to provide the care and how they're going to stay on top of it as these changes occur.
Okay, we have another question in the audience.
Hi, my name's Kathy, and I actually spent a lot of time in at a facility with my father-in-law who died from a massive stroke in bed, and they didn't find him for quite a while. But one thing I got to do was notice the staff very well. And they are very underpaid. And that is one thing that in advocating for the people in the facility, it is important to get better quality people. We have to figure out a way, and I could never figure it out, on how to get the money, and then people that were more qualified to be there, or the good people would stay. Because we had some great people that took care of Dennis, and they had to quit because they couldn't even take care of their families. Right. And the other point really quick is that Dennis was a type 2 diabetic, and I worked very, very hard at helping them develop a eating schedule for him. His food was stolen. The food that they cooked was terrible for any of us.
Thank you for sharing that. Melanie, so again, you're an ombudsman. How is it that, I mean, what are the circumstances? Carrie and Brad found some of these facilities were able to employ people for long periods of time. They had stable staffs. Things worked well. Others complained that they can't afford to hire staff, and even if when they can, they don't come in well trained. There's a lot of turnover. What's the difference? How do you find the model for what should work here? How do you? I mean, how does this work?
I think part of the reason there's turnover in staff a lot of times is there isn't enough staff. So partly it's a payment issue, but partly it's if you're trying to care for 25 or more people because someone else calls out, you get frustrated.
That's right.
You can't do the job you want to do, and then you leave. So I think we need to make it a priority to make sure that there's good staff in facilities and pay them well enough. And so especially assisted livings where people are paying $10,000 a month. We have to look at, I think, the business model about that. Now, the thing is, for assisted living, we don't have state funds going into it. But nonetheless, I think the AJC articles are sort of highlighting we as citizens, as people with loved ones in long-term care facilities, have to push more for better staff. And similarly, I think with the healthcare facility regulation folks, if we had more surveyors going in more often, when family members identify problems and they call and report it, if we had more regulators, they could get out sooner. Sometimes it takes a while for those problems to get resolved and bad things happen.
Last question from someone online before we have to get to our last section of the show. Is there a place online where people can report problems that they've found with facilities?
Yes, and we have links to those on our website, ajc.com/unprotected. And you can file complaints online, and you can also call the Ombudsman's office. Call
Melanie's office and get in touch with them, and they will help you and file complaints, and also call, if in some cases, people call the police if it's warranted.
All right, we're down to our last section of the show, and I guess what I'd like to do is ask you each to kind of briefly, and start with you. No, you know what, Carrie? You and Brad should go last on this. Let me go down and have you come up the line. When you absorbed what you read that the AJC reported and matched it to the experiences that you've dealt with yourselves in dealing with this field, what's the overarching, what's the one thing that comes out of it that really resonates for you?
That we really need to take a list almost of the different issues that we saw that were a problem, and we need a systematic plan for addressing them so that it doesn't continue, and that we put the training in place to address those issues.
Melanie?
For our ombudsman representatives, and for me as the state ombudsman, I think the articles really kind of reinforce what we see, but we see it, one resident at a time. And so it really, I'm appreciative that it's brought a light, shown a light on problems so that we all, as a community, as Georgians, can say, we need to do better. We need to do better with this. We need to hold facilities more accountable for serving our most vulnerable.
Jason, is yours, did you look at it primarily from a law enforcement point of view?
I did, and what really resonated with me, and I think I echo some of what Melanie said, it was nice that someone was shining a light on an area where I think many of us, particularly over the past few years in law enforcement, have been working and somewhat feeling that we've been banging our head against a wall trying to get people to listen. And so it's nice when someone else can get the message out, because I think that there is more here. I think that there are problems. I think we've made improvements, but we have long strides still to go.
Representative Cooper, you'll put it in your own words, but I would say it seems clear to me that one of the things that comes out of this for you is you got a bunch of legislation you might be proposing in the January session.
Or the biggest ombudsman bill that you've seen coming down, because as I've looked into all the issues, I mean, the GBI has suggestions that we can make. Our administrative law judges, if you get fined, you can appeal those fines. The administrative law judges are just generalists. They don't really know about what goes on in the elderly care field, and they often, the person who appeals them wins, so they don't even have to pay the fines. We need at least one administrative law judge that knows what they're doing in a field about elder care. More surveys. The state, still you turn in your surveys on paper and your complaints go on paper. If they were on the computer, things would move a lot faster and we could get to them. There are just so many problems all the way around. The need for education, it'll be hopefully it'll fall under one bill, but it may take multiple bills.
So I don't want to get you deluged with people giving you input, but do you want to hear from the public about their thoughts and ideas?
If ways that we can change the system.
All right.
Ideas for bills often come from people in the community. We now have a pharmacy that sends free medicines all over this state to people in need because an elderly gentleman didn't know what to do with his wife's medicines after she passed away. Now, we can't take those because they were in bottles that had been used, but out of that came a pharmacy that gets from pharmaceutical companies medicines that are, they have too much of, and we are helping people all over the state. And that came from a citizen. So yes, I do want to
thank you for that. Brad and Carrie, I want to talk to you about next steps, if I may. We as journalists, the notion is that we remain somewhat neutral. We don't advocate for changes. Well, we do to some extent, but we're always supposed to be sort of neutral. But when you do an investigation like this, Brad, this is the best kind of advocacy journalism. This is journalism that cries out for change, I think it's fair to say. So what are you two, and each of you can answer it, saying about next steps? You're going to keep digging, but what do you think should happen? What should the public be doing? Is that a fair question?
Well, I mean, I think as journalists, one of the big findings of our series and one of the things we tried to address is the complete lack of transparency and information in the system. These places, if you go in them, you will often find something that looks like something you'd want to move into. I mean, and we found, I mean, you know, like spa, I mean, every one of them has a gourmet chef. I mean, you know, they all are sort of, it sounds great. And I guess one of the things that people need is real information to be able to cut through the marketing and get what is the reality, and looking at staffing levels, you know, just more transparency so that a consumer can go out, a family member can go out and make informed decisions. And I think as journalists, we're always advocating for more information. I mean, that is something that the system really needs.
Carrie, I love the fact that in the video we all looked at, there's a shot of you at home with your daughter, I assume, high school age daughter?
Middle 8th grader.
I wonder if you have an elderly parent out there too, either, you know, that you're thinking about the future for, or your own future when your daughter,
moves off. My parents are deceased.
Okay.
But I will say that everywhere I go in my life, you know, whether I'm talking with friends at school, at my church, just around the neighborhood, and any time I just mention what I'm working on, everybody's talking about their parents, their spouse. Everyone is talking to me about this with a very personal story.
So what did you come away from all of this, from the past year or so of work on this series? What's the biggest theme for you?
That people need to be able to live out their most vulnerable years with dignity. And that when people can't speak, can't care for themselves, that it's not okay to take advantage of them in that situation, and that we all need to say that's not okay. We are investing a gigantic amount of our time and resources to actually tell you what's really going on so that you can act on it, because everyone has a personal need to act on this situation. Everyone. And so I think of all the many, many stories I've done in 30 years at the AJC, this is the one that probably touches our readers and our community in a very personal way. And I would like to thank our subscribers for reading it. Please continue to read, because I'm spending many more hours on documents and interviews and meeting with people. And we're going to tell you way more stuff that you need to know, that once you're armed and equipped with that knowledge, it can help you make better decisions as a consumer, but it can also help all of us achieve change. That's why we do this kind of work that we do that takes months and involves a lot of hand-wringing and tough conversations with people. And if you guys don't read it and share it with your friends and family and on your social media and clip out the newspaper like we all used to do and send it in to your lawmakers and call them and share it, it won't have the impact. So thank you for reading it, but please continue reading it and sharing it. And that's so gratifying to me when that happens.
Thank you for the passion that you clearly have brought to this story. And to you, Brad, for the work that you two did, and to all of our panelists who responded tonight to what the AJC learned. I just want to thank you for sharing your thoughts about George's Unprotected. Your insights, I hope, will spur people to the kind of action you talked about tonight. So as we close, the AJC did a great job. Where can people go if they have not read the series? It's all posted online.
Right.
You said it's ajc.com/unprotected.
Yes.
And in addition to reading the stories, you can look at this database that you've been compiling, right?
Yes. Okay. You can look up every facility and see all their inspection reports, and we've flagged violations that you need to know about. We've given you a lot of context and guidance, and check it out.
All right, real quick, Sharon, real quick.
As it's follow-up for yours, as we put legislation forth, you would think that it's common sense that it's all going to pass. But as you read the news article, we also follow the legislation when we're in session in January and talk to your legislators, your House member and your Senate to say, support the bills.
Okay.
Help us out, because sometimes these bills are very hard. Jason?
Sharon Cooper, you have won the last comment of this program. I want to thank everybody, the AJC, GPB, for being a big partners in presenting this program tonight. To all of you in our audience here who are watching online, thank you too for being with us tonight. I'm Bill Nigut. Good night to everybody.